Welcome, everyone. This is Mayor Steve Haggerty, and you are joining our coronavirus Q&A, the last one of 2020. Thank goodness. We didn't start out the year thinking that we were going to be doing anything on a pandemic, and yet here we are living it every single hour of the day. And for the last session of the year, I wanted to double back to something we talked about, I think in the late summer. We had a Q&A session on mental health. And mental health is a rising issue in this country, irrespective of a pandemic. And it's something that we need to focus more resources on, more attention on. And so I'm pleased today to have the two leads of our mental health working group, part of the Mayor's Pandemic Task Force, with us. We have Dr. Christine Somerville, who is with NAMI, and Dr. Adia Gooden, who is with the Family Institute of Northwestern. And so when I turn it over to each of you, just so it's been a while for our audience, just give a real quick, just a little of your background and who you work with and what your specialties are, if you have any of that. We did have a coronavirus Q&A last week where we spoke about the vaccine. We will be doing another one of those with the topic on vaccines when we all get back from the holidays, because I know that's top of mind for everyone. I did run through the situation report last week. I'm not going to do that this week, other than to say, the advisory is still in effect for us to stay at home as much as possible, to limit our interaction with others, as difficult as that is, particularly during the holidays. These protocols are making a difference. Our median, or our 7-day average, has dropped. It was around 35 a few weeks ago. It's now down at 25 cases a day. Our positivity rate here in Evanston is about 5.5%, based on the situation report that I looked at this morning. So, all in all, our numbers have gone down a bit, and that's because of all the actions that everyone in our community is taking. So thank you for that. So let's turn our attention, though, to the mental health working group. Why don't we just start off, Dr. Somerville, with an update for our audience of what the focus of the mental health working group has been, and then we'll take the conversation from there.
Okay, thank you, Mayor, for inviting us. We're happy to be here. I am Christine Somerville. I am the Director of Programs at NAMI, Cook County North Suburban. I'm also a certified mental health first aid instructor. And my background and specialization is I'm a mental health educator by training. So the task force has been working for the last 10 months, I think, really, on 3 major projects. One was to put together kind of we're calling it a dashboard for the community. So it's metrics that we are looking at for Evanston that can be viewed sort of in tandem with the metrics that we look at for the pandemic. So on a regular basis, we hear updates from the Department of Public Health around hospitalizations, infections, incubations, and that sort of thing. So we wanted to have a dashboard on mental health metrics that could sort of parallel that and help us track and understand what's going on in Evanston with our residents. So that's one piece of it. The other piece is a resource guide and some education materials, and I'm going to let Dr. Gooden talk about that.
Sure, really happy to be here today. So my name's Adia Gooden. I am a licensed clinical psychologist, and I'm the director of the Betty D. Harris Child and Family Clinic and Community Programs at the Family Institute at Northwestern. So I do see clients, and then I also oversee our sliding fee scale clinic. So we have put together educational resources, and the main aim of that is to get the word out of that mental health is essential, that it is important, and to provide some easy and accessible tips to help people take care of their mental health. And those have started being shared during the fall and will be shared throughout Evanston, both online via the Evanston newsletter and in person in paper format. Starting in 2021 as well. And we also worked on creating a list of mental health service organizations that provide free, low cost, or accept public insurance for mental health services. So for individual therapy, couples therapy, family therapy, therapy for children, substance abuse treatment. So we really wanted to compile a list so that everyone can feel like they can access mental health services, which are really needed right now. And we put that list together. I believe it went out in the newsletter, the Evanston newsletter last week, and we're going to be working on sort of getting it widely distributed so that people know how to access care when they decide that they could use some extra support.
And one last thing, we also created a survey, a community mental health survey, because we wanted to ask residents how they're feeling during this time. It's the questions that we're asking are nationally referenced, and they're on the city website. So it launched, I think, a month ago with surveys. We're getting good responses. It's both in English and in Spanish. So we would encourage anyone to go to the website and to complete the survey so we can find out, how you're feeling.
Right. I would say I completed the survey as soon as I saw it, because I wanted to see what the survey was asking and all of that. So I would encourage our residents to do that. I forgot to mention at the top of the show that this is being broadcast live on the city's Facebook page, as well as on Channel 16, which is the local television station here in Evanston. If you have questions during the show, we're going to take those questions for either of the doctors that are with us. So just go ahead and put that on Facebook Live, and our communication staff is monitoring that. Let's start here. And this is for both of you. So let's start with you, Dr. Gooden, on this one. You mentioned up front the three major focuses of the working group, the community dashboard, and there's a bunch of data that you're assembling on sort of a baseline of where our mental health is, and then measuring that through your community surveys that you're doing, and then the resource guide. So you've seen that data. You're a professional in this field. What are your top concerns when it comes to mental health over the next several months?
Yeah, it's a really good question. I think, people are exhausted, right? People are really tired of only being in the house and not being able to go out and not having a lot to look forward to. People are really lonely, I think, especially if they're living alone. And we know that loneliness can be really connected with depression and cause a lot of health issues. Some people are starved of physical touch if they live alone. And that can be a real challenge. We're mammals and we need physical touch to be healthy. And so I think my concern for the next few months is just that these things will get worse, right? That it's winter is coming in the Chicagoland area, in Evanston. There's going to be less opportunities to go outside, less opportunities to gather safely outside at a with physical distance, and that people will feel more alone. There's less sunlight. And, we know that many people, I think I read a statistic this morning that said maybe 10 million people are affected by something called seasonal affective disorder, which is when you experience depression in the fall and winter when there's less sunlight. It just affects you in a lot of different ways. So I'm concerned about that. I'm concerned about people who are alone and isolated, feeling more alone and isolated because of access to in-person connection is limited right now, because it's risky and because it's hard to be outside and gather that way.
Mm-hmm. Dr. Somerville, anything to add to what Dr. Gooden said there?
Yeah, and that was a really good response, very comprehensive. I think I would add also that I am concerned about all of us having these feelings of hopelessness and uncertainty. And I mean, the reality is for the last 10 months, we've lived in a state of uncertainty. We don't know, will I or someone I love get sick? Are my job and investments secure? Well, the election, what do the election results mean? That's always been a source of stress for quite a bit of time. And when will it feel normal again? So I think the feelings of uncertainty are really of concern, because persistent uncertainty can alter the brain's architecture and increase long-term risks of depression and cognitive impairment. And it can also, change your thinking, alter your thinking in terms of having you be less likely to take risks, less likely to focus on the future in positive ways. And so our perceptions of time change, and the present seems endless. We feel cut off from the past and the future. This is something that I wake up every day feeling like it's Groundhog Day. And just our feelings, our feelings create ambiguity creates worry and unease. And we know from research that waiting for the outcomes of something serious like a biopsy or fertility treatments generates more anxiety than receiving a diagnosis or the result of that. So it's this intense and persistent, unrelenting uncertainty that I think is problematic and troublesome.
That's a really interesting point. So what advice would you have for organizations, including me as the mayor of Evanston and leaders of other organizations out there who, want to take care of their people and we don't want false hope out there. There's this great news, there's a vaccine if you were worried, but that solution isn't coming to you tomorrow. Maybe it is if you're a doctor and you deal with COVID patients, but that's where we are. There's a priority list, and it is going to be, many months till some people get this. And I don't care if you're old or you're young, your level of anxiety, may vary, and it's not the most, the people that feel most anxious, you're going to be first in line or something along those lines to try and, help. So what advice would you have for organizations for how we manage that? Because again, false hope is not something that we want. We really want to communicate honestly and get a message through to people that, the pandemic's not over yet just because we think we have a successful vaccine and it's been tested well and all of that. Any thoughts there?
So I would talk a little bit about, there was an article in The Atlantic this past July called Our Pandemic Summer. It was written by Ed Young, and he talks about a formula for resilience and describes what he called the Stockdale strategy. And I think this is something that's helpful. I don't know exactly how we will translate this to an organizational context, but I just wanted to share this with you. So the Stockdale strategy goes something like this. Vice Admiral Stockdale was spent 7 years in a Hanoi prison being tortured during the Vietnam War. And when he got out, he was asked how did he get through it? And he observed that there was what he called a fatal optimism among those who broke. And he said that these men set imaginary deadlines that came and went, and it led them into further despair. And I think this is kind of a point of inflection here, that if we set arbitrary deadlines like I'm going to get my vaccine in March, and March comes and goes and you're not up for the vaccine yet, that can be devastating. That can lead to some feelings of despair. So the Stockdale strategy was to encourage people to meld hope and realism, that we all need to have an unwavering faith that we will prevail, and meld that with the discipline to confront the brutal facts. So we all know what the brutal facts are. We all know, as you mentioned, Mayor, we all know that this isn't going to end anytime soon. And so I think our message to our people, the organizations, is you have to have some level of faith, and you have to be realistic about when this is going to end. And I also think making plans is helpful. Even though the future is uncertain, planning for the future is a very productive way to reclaim our agency.
Yeah, faith and facts are our friend and are important. And again, if you're one that is really feeling some despair over the way that this year has unfolded, I will just remind you, when I was on a call this summer with Dr. Fauci these hundreds of others of mayors around the country, he made it very clear that the risk that the federal government is taking is not one of people's health. We are not going to put a vaccine out there that is unsafe. He was very clear about that. The risk that we're taking is whether we can accelerate the development of the vaccine, and we are putting billions and billions and billions of dollars towards that. And if we get some breaks and everything else, he said, I think we could have a vaccine by January, February 2021. He said, if we don't get the breaks, it could be, the fall of 2021 before we have something. And here we sit in December of 2020 with not one, but 3 vaccines, 2 that have been approved by the FDA now here in this country. I would also say have been approved by other countries, which I think should give you a sense of relief that it's not just, even if you're like, well, I don't trust Trump and everything else, we're talking many other developed countries who have experts in their countries and everything have looked at these vaccines and said, yes, these pass our criteria too, and they're bringing them to the market for their citizens. So I think facts and faith in our ability to solve really complex problems, and that it really does take a team of people with all different backgrounds to do that. I find very inspiring. And when I'm just a little down about, oh boy, are we ever going to get through here? I often think about that and it helps me. I want to talk a little about just the resource guide, because I think that's a terrific document that you've developed. And I do think and know that there are people that are in some despair in our community and they don't know where to turn. And they may talk to a friend and the friend doesn't know where to turn either. They're not an expert. So that resource guide, is that available on the web? Could we put that into the Facebook feed right now? Or if we know what it is, could that be shared with the public? And if either of our guests don't know, Patrick Degnan, who's our communications director, if you know where that is online, if we could put that out here for folks, Patrick, I'd appreciate that. Dr. Gooden?
Yeah, we'd love for it to be shared. So I think thank you. Thanks, Patrick. So yes, we'd love for it to be shared. And our idea was really, how do we help to lower the barrier to access care, right? Because we already know that it's hard for people to even say, I need a therapist, or I want some support. And so once people take that step, we want it to be really easy to find help and to find support and to be clear, like, who do you call? Where do you call? What kind of services? Because, we have the Evanston Care Network, which is awesome. It's really a wealth of resources. And this is sort of information that's taken from Evanston Care Network and put into a very simple format so people can see it and make a call, or see it and click and get to a website and make an appointment, and they can know, okay, are these services going to be free? Do they take Medicare or Medicaid, or is it sliding fee scale, and what kind of services are they offering? And so we really do hope to get it, shared as widely as possible, because we want people to know that if they need help, they can access it. And there are affordable ways to access it. And we don't want anyone to feel like, well, I would love therapy, but I don't have insurance, or I don't have money for a copay, and so I just can't do anything about it.
Dr. Gooden, sometimes, people think, the challenges that they're facing alone. They're the only ones that have, that challenge. As a clinical psychologist, could you talk to us a little about what are you seeing among different groups? So among children, among, people that are in committed relationships, among, older residents. I think that would be helpful. And then, link to that to the types of resources that are available to help each of those sectors or segments.
Yeah. So I think one of the things I've heard a lot is people, my clients or other people saying, well, I'm stressed, or I'm anxious, or I'm overloaded, but I know I'm not the only one, so maybe I shouldn't feel stressed. And I think the reality is that it's normal to feel stressed in this situation, right? We are in a pandemic. Most of us have never lived through a pandemic before. Maybe some centenarians have lived through, another pandemic, but most of us haven't to this extent. And so I think it's important to recognize that, like Dr. Somerville was talking about, the uncertainty is exhausting. It is hard to make plans and have them changed. It is hard not to know what's going to happen. I think, families with young kids at home trying to manage e-learning is really challenging because often the parents are working, they're trying to manage their children's e-learning. Some kids are doing fine with e-learning and some kids are that's not how they want to learn. It's very hard to stay focused. And so it's frustrating. They can't connect to their friends. They're not learning. They may not be getting the support that they need. So all of this creates a lot of frustration and tension within families, within individuals, right? Parents are, I think, worried about how their kids might be falling behind, right? And there can be stress and frustration. And often what happens in families is, that comes out to each other, right? You may not really be so frustrated at your partner or at your kid, but the situation is frustrating. And if you don't have time to sort of think that through or process it, then it sort of comes out at, being upset with your child or being upset with your partner and can create this conflict and tension. And that's why a family therapy can be really helpful. Couples therapy can be really helpful, just to have another space where someone's saying, this is normal, and how do we help you communicate? A lot of the couples that I've been working with, there's one partner who's much more conservative in terms of taking risks around COVID. So says, yeah, we can eat outside or we can do this thing. And another partner who says, nope, I don't want to do anything. I'm really anxious about it. And that's often a source of tension, right? How do we navigate one partner wanting one thing and the other partner wanting the other thing without any very clear mandates about what is and isn't allowed? And so, couples therapy can help people navigate that. I've heard for older people feeling isolated, right? I think, the elderly are often already isolated, and whether they live alone or in, an assisted living facility, not being able to see family or friends or get outside and connect, right? That's really lonely and really hard. And maybe not always understanding if somebody's dealing with dementia, what's going on or why they're, not being able to connect or go out or do the normal things can be really difficult. And so I think with that sort of support groups can be really helpful, and opportunities to connect via Zoom, figuring out that technology can be really helpful to mitigate some of the isolation and the loneliness.
Great, thank you. Dr. Somerville, anything to add to what Dr. Gooden said there?
Wow, I don't know. I mean, that was a lot. I'll just share a little bit of research that I had done prior to our talk today, that the National Association of School Psychologists had recommended helping children cope with the changes resulting from COVID. And some of the things that they suggest are, and this is for younger children, to stay calm and listen and offer reassurance. Monitor television viewing and social media. They suggest take time to talk to your child, be honest and accurate, and keep explanations age appropriate. They say to stay connected with the schools. That's huge because, also the parents are under this level of stress of not only figuring out their relationships with their significant others, but having their relationships with their children ever present. And now they're being expected to be sort of a quasi teacher because the children are learning at home and needing help. So that connection with the school is important. Being aware of your child's mental health, and then some suggestions that came from the American Academy of Pediatrics for teens included things like work together to create a new normal. So like stick to a schedule, allow dinner to be a transition time for your teen, give them downtime. That's really important for them to be alone. And communicate honestly and openly, share information about what is happening, and stress staying at home saves lives. Make sure that they're not thinking that they can go out and hang out with their friends with or without masks. It's not good. And help your teen to look forward, stay connected virtually and, with your family members. So those were some suggestions from those organizations that I thought would be helpful to share.
Now I'm asking for a friend who, in his family, the tensions are highest later in the day. And, he wonders, A, is that pretty common? But it's later in the day. And are there any specific techniques? Because, everybody's been at home, and, dinner may not be as pleasant as it was before, although you are having dinner together. So I guess there's some talking going on. But, have you heard, is there anything to like, generally when, the stress and the tension tends to be higher if there's a certain time, and if there's any specific techniques that you recommend to people or families?
Yeah, I think, tension being higher in the evening makes a lot of sense, right? If we think about the mental and emotional energy we're using up throughout the day, right, to focus, to pay attention, to navigate Zoom calls or whatever it is, to sort of just gather ourselves and try to do what we need to do. I think it's taking much more energy, especially if you're sort of managing e-learning and managing your own job and thinking about this, right? There's so many more things going on because many of us are working from home and we don't have the same boundaries between work and home that we used to. So everything sort of gets mixed up together, and that's hard. And so then by the end of the day, you sort of run out of all that mental and emotional energy you had to be polite and be patient and be gracious. And so I think it could be helpful to have some sort of buffer where, everybody is on a timeout. It doesn't have to be a punishment, but everybody goes to their rooms. Like if you have separate spaces, you can go there and just take 30 minutes to just be quiet, be alone. If you don't have separate spaces, maybe it's putting on headphones and listening to music. Maybe it's going outside for a walk. I actually, the winter's coming. It's snowing today, and getting outside for some fresh air, just some mental space. Even if it's cold, bundle up, right, and get outside and just take a little break, take a little breather. And that will help to reset so that when you're having dinner together or when you're together, it doesn't just feel like an extension of the day. It doesn't just feel like an extension of all these people at work were asking me for all of these things. And now my child is asking me for a thing and I'm, can I get a break, right? You've taken that time. And I realize that sometimes that's harder to organize, right? If you have little kids, it might be harder to take a break from them. I know when I was a toddler, my mom used to put me on my bed with all my stuffed animals and say, you don't have to sleep, but don't get off the bed. And that was her break. So you might be able to try that strategy. But trying to get some space, right? Whether it's in the bathroom or for a walk or with headphones, getting a little bit of a mental break and space, I think will help to relieve some of the tension that can build over the course of the day.
Thank you. I like that response because there were some very specific suggestions there, Dr. Gooden. And the point I guess I want to stress is everyone has stress. Everyone has tension. We have it to different degrees. It's not an abnormal, feeling to have. It is very normal. But if that feeling is really affecting your ability to be the person you want to be or to get things done and be productive and all of that. That resource guide that we talked about a few minutes ago, I wanted to share with people where you can find it. We do have that resource guide, and this is a mental health resource guide available on the city's website. It can be found at cityofevanston.org /COVID resources. So if you just go to the city's COVID page, look at COVID resources, and you will find that there. And it's pretty extensive of the services that are available here. We are fortunate as a community that we do have a lot of resources, but oftentimes people don't know necessarily where to look and find that. Look, I want to turn a little and just talk about grief for a few minutes. There's I think there's a lot of grieving going on this year. Either, people who know somebody, have had a parent or a grandparent or a good friend that has died. We just had somebody here in the city whose father died at 64 of COVID. Obviously, she is hurting and her whole family is just shocked by this. But many of her friends and acquaintances who are aware are also sort of carrying that, even though they didn't necessarily know her father. I think that that's probably pretty common, I'm presuming, not just in our community, but around the country. So can we talk about grief for a little bit, and, what the natural reactions, emotions that people are having, and what people can do to try and deal with that and overcome that in this environment, particularly?
So let me start out. I think, grief is one of those things that really does make us feel self-isolated, because everyone grieves differently. And we all have sort of an expectation of what grief should look like and how we should engage with it. But the truth of the matter is we don't know, and we don't know how another person is experiencing it. As I mentioned earlier, this time warp that people go through, where the present doesn't end, is a very common one with grief. And, and I think it's important to just to not have expectations of ourselves when we're feeling a sense of loss, which is where where grief comes from, the loss of things that are familiar to us, and the loss of the ways in which we live our lives, the ways that we show up now is different. So even for those of us who haven't lost a loved one, have that experience of loss ourselves. But I think it's important to just recognize that there is no one way to go through it. There is no one answer to make yourself feel better. For some people, living in the grief and experiencing it, letting it wash over them, is something that works for them. For other people, it might take weeks, months, and years for that grief to sort of subside. And we have to be patient with ourselves and with others around that.
Yeah, and I would just add that, the grieving process isn't linear. So, people might sort of expect, okay, it's been 3 weeks or it's been 4 weeks, so I should be done with it. Or I felt better last week and now I feel like I'm grieving again. And so just to know that there can be sort of ebbs and flows with grief is important. And I really echo what Dr. Somerville was saying about sort of being compassionate and knowing that there isn't a right way to grieve. I think one of the really challenging things related to COVID is that it's really hampered our collective grieving. I think there's something really powerful and significant about being able to have an in-person funeral or memorial service. And I know that people have gotten creative with Zoom services and, things like that, which is helpful. But there's something about being in person, hugging people, being hugged, lamenting, crying, and honoring the memory of someone that is healing. And I think it's really hard that people don't have access to that in the same way that we would during normal times. So that's just, I think, useful to acknowledge. And I would encourage people to think about what are the ways that they want to honor the person that they have lost, even if it can't be in the way they wish it was right now. One of the things that my father said to me when my grandmother passed away was that my grief, my tears, and she didn't pass away this year, honored her, right? So I think it's important for people to remember that your grief, your mourning honors the person who you lost, right? Because it communicates that you loved them, that you cared for them, that they had a really important, meaningful place in your life. And you're going to take the time to honor the fact that that has changed now. And it's sad and heartbreaking and disappointing. And I think when people can sort of keep that in mind, that allows them to give themselves room for that and not to feel like, oh, there's something wrong with me or I should get over it. No, this person was important to you, or this person represented something, even if it wasn't your family member. And so giving yourself space for that and finding other creative ways to connect with other people who are grieving can be helpful.
Thank you, Dr. Gooden. I think that there's a lot of grieving going on this year with the loss of traditions. So there's the true grieving, you've lost somebody and you can't have that memorial service or that funeral, which is a part of our tradition as a culture. And And I see that right now, and I do worry, and I even feel this personally a little, that, there are, and my family's Christian, we're Catholic and everything, so there are certain traditions, right, this time of year, like, to my family's annoyance a little, maybe I like to listen to Christmas music all the time, so I would have it on all the time. But for my wife, it's going to church on Christmas Eve or Christmas Day, and all the pageantry and everything around that, and that's a big family tradition. And Hanukkah just started last week. There's a lot of tradition around that, and families getting together, and we're not able to this year. And so, I think that clearly, has an impact on people's, well-being and how they're feeling at this moment. But again, I think it's the hope, and the optimism that's really important for us to realize this isn't, perpetual. This isn't in perpetuity. It's going to change. It may look different when we finally get through this pandemic, and that is a helpful exercise when you're in that stage. We had a question from Mark, who asked, has there been a documented increase in mental health issues linked to lockdowns and other efforts to contain the virus? Is there any research on that either of you are aware of?
Yeah, there has been some research. There was a study done at the University of San Diego that looked at sort of the impact of the pandemic on individuals. And some of the outcomes of this particular research were that people were eight times as likely to screen positive for a serious mental illness since the pandemic began. And that the vast majority of the participants in this study, 70%, met the criteria for moderate to severe mental illness compared to 22% prior to the pandemic. This study also showed that younger adults, ages 18 to 44, the iGen and the millennials, have borne the brunt of the mental health effects, that they've experienced a tenfold increase in serious mental distress compared to 2018, prior to the pandemic. And
what age was that, doctor? The group between what ages?
18 to 44.
18 to 44. Wow. Okay.
Yeah, that younger adults. 44 maybe is on that borderline, but anyway. So yeah, they experienced a tenfold increase in serious mental distress. And then interestingly enough, adults 60 and older had the smallest increase in serious mental health issues related to the pandemic. And, the author of this study suggested that older people are, one, more protected from the economic disruptions than younger people, working people who may have lost their job or may find themselves in a precarious financial position. So that was one explanation. For people who have been experiencing mental illness prior to the pandemic, they found that the depression among 18 to 25-year-olds, that it has been exacerbated, of course, as we would expect by the pandemic. So that was just one study. There are many. I think there are many studies out there, but that was one that I wanted to share with you.
Thank you. I had a question from Dee Dee. And I think, again, this gets to, a question for Dee Dee. And her question is, when does the city expect that things will go back to normal? So let's just talk about normal and what's normal. I think people are saying, well, normal is what it was like, pre-pandemic. That was normal. And, there's this uncertainty if we ever go back, there's an uncertainty over how long are we going to have to wear masks. As we talked about at last week's coronavirus Q&A, even though the vaccines will start to roll out, we still are all going to have to wear masks for a while. And the reason is because they're not clear from the studies that they've done, whether you could be asymptomatic So not showing any signs of having the virus, but being able to spread it. And so there's continued studies going on as we roll the vaccine out, but we will all be required to wear masks for some time. So could you both talk about this, idea of normal and how we, get our heads around thinking about that? And yeah.
Yeah, it's hard. I think probably at the essence of normal is, when will I not have to worry about this? When can I make plans and trust that I'll be able to, they'll come to fruition? When can I go out and see people without worrying about the risk? When can I just be more at ease, right? When will we not be all cooped up in the house together? And I think it's been useful to sort of think about what are the things that we maybe don't want to go back to, that were normal before, that we might not want. But I think that people want to have a sense of, I can just leave my house without worrying. I can just get together with people. I can just know what's going to happen. This uncertainty won't be so overbearing. And I think that's what people want relief from, is all of the uncertainty, is all the feeling like everything is a risk, and the exhaustion of it all. And so my hope would be that once the vaccine is more widely administered and it's sort of clear, this is how you keep yourself safe and your family safe, that even if people are still wearing masks, and even if, the vaccine is still being rolled out, that people feel a little bit more at ease, that people feel like, okay, here are the steps we're taking, here's the steps I can take to keep myself safe, but we can sort of get together with people. We don't have to wait until we take a trip or whatever it is.
I want to inject something, and then Dr. Somerville, if you can add to it. I think in our minds, we sometimes think, well, normal is the static, situation that I'm in. But if we really took a step back, nothing's ever normal. Your kids are always growing up. You're getting older. Maybe you retire. Maybe you change jobs. There's lots of change going on. You're much more resilient than you may realize. So I just wanted to inject that as you're thinking about this question from DD.
Yeah, I think that I agree with both of you that this idea of normal, one, it doesn't exist. And two, it's something that we think about, but it doesn't really exist. But secondly, it's our feeling of what's familiar to us. That I think is the closest thing that we could come to what feels normal, is what feels familiar. And I don't know, I had the opportunity to engage in a conversation with a couple of members of the community, our Black and Brown community, a few weeks ago, and we asked the people that joined us in this conversation, does life seem more complicated or more simple since the pandemic began? And I was surprised at what people said, because many people said it was far more complicated. And but there were also a handful of us, and I'm going to put myself in this category, said that life has become more simplistic. And so I think it's sort of how we look at our environment and our world. So for me, that simplicity is, I get up in the morning and I'm at home all day long. I do my work. I sit in mostly the same chair. All of my routines, all of the way in which I show up every day is the same. And there isn't a lot of variation in that theme. For the people who felt that life was much more complicated, they said it's when you go to the store, you have to make sure you have your mask, you have to make sure you're social distancing, you have to make sure this and this and this and this that the health experts are telling us. Wash things off, wash your hands constantly, all of these new things. So again, that's the unfamiliar that made their lives to them feel far more complicated. So it's an interesting thing to think about. And I think it's different in it's different for everyone, but it's different. That sort of concept is different in our different communities as well. I think there's a cultural difference involved in that as well.
Great. All right, I want to wrap up. We're at the end of our time today with a question for each of you, and I'll answer it as well at the very end before I close our session. We mentioned at the beginning or during the session, it is normal for us all to have, low points and stress and tension, even more so this year with the uncertain year and difficult year that it's been for all of us. So going into recognizing that we all have those, moments, whether you're a, psychologist or a mayor, what gets you through those moments in your life? We'll start with you, Dr. Somerville, and then Dr. Gooden.
Wow. So I think it's just, I think about the fact that this is a moment in time. The kinds of things that I'm experiencing right now are not, what I'm going to be experiencing forever. I have my routines that I enjoy. I do too listen to Christmas music. I love Christmas music. I try to exercise. I enjoy my Christmas tree. I find that I'm reaching out more to friends than I used to. And I think that the connections that I'm making are really valuable in that regard. I think it's the connectedness that's probably getting me through the difficult feelings more than anything else.
Great. Thank you, Dr. Somerville, and thank you for all of your work helping lead the mental health working group for the pandemic task force. Dr. Gooden?
Yeah, so I agree with relationships, friendships, connecting deeply and intentionally has been really helpful. Being really kind and compassionate with myself when I have hard moments and, I'm struggling has been really helpful. And then for me, meditating every day and trying to exercise frequently and take walks when I can. And then practicing gratitude, looking for things that are going well and are positive and focusing on them.
Great. Well, I have one thing in common with that, Dr. Gooden, which is walking my dog. So we got a puppy back in August of 2019, about 6 months before the pandemic, and he has been such a great addition to the family. I think he, definitely helps us reduce some family stress and all of that. But the other thing that for me, inspires me and just makes me feel positive when I may be a little low is I really do think that, despite the challenges that we have confronted with this virus and some of the decisions that we may look at and be very upset about, for instance, if you feel strongly that, hey, we should all be wearing masks, which I feel strongly about, we are doing a great job here in Evanston about that. But some people don't, including the President of the United States. If you're frustrated about that or whatever, it's understandable. I get it. But I think that, I am just inspired by the interrelatedness of all of us that is front and center right now, that everybody is essential. You may have started the year thinking, oh, you know what, scientists and doctors, they're really essential. And no doubt they are. I mean, they're helping us, but so is the grocery store clerk, so is the delivery driver that keeps coming to your house, with packages or food. So are all of these volunteers that are stepping up, to feed those that are struggling right now. So are all of those that have some money in their wallets and are turning it over to an organization to help people. So I find that incredibly inspiring, that we all have to work together to get through this, that everybody is sacrificing. That sacrifice hasn't been the same. Certainly there are big disparities in that. But everybody has a stake in this. And we are going to get through this. And we, have faced difficult times before as a community, as a country, as a world, and we have always gotten through it. And I see nothing to make me think that we're not going to get through it again. And again, the good news this month with the vaccines, So I think there's lots to feel good about and be inspired about, despite the year that we've all been through. I appreciate both of you for taking the time to join us today. I think it's appropriate that this be our last coronavirus Q&A for 2020. As I mentioned, we will do another one in January to kick off 2021, and that one we will focus on vaccines. We'll know much more about the vaccine distributions here locally. We are waiting right now to get our first fulfillment of vaccines that are going to go to the frontline medical healthcare workers who are literally working with COVID patients. So we're going to be getting that shortly. And again, every community is getting them. They're not huge amounts. It'll be less than 1,000 that we get here in Evanston, but we'll go to our frontline healthcare workers who have been huge heroes this year in saving lives and taking care of so many of us. So I wish everybody a happy holiday season. Take good care of yourselves, both your physical health, your mental health. Take care of your family. Take care of your friends. We will see everybody in 2021. Thank you.